Now let me discuss about the alkylating agents. Right, let me discuss about the alkylating agents. Now if you take this particular alkylating agents, remember all the alkylating agents and as well as their related drugs, they are CCNS drugs. Now what do you mean by these CCNS drugs? These are the drugs which act on both. That means they act on both dividing cells and as well as the cells in the resting phase. Right, these are the drugs which act on both the resting cells and as well as the dividing cells. Now if you take the mechanism of action of these alkylating agents. Now before going into the mechanism of action, let me tell you the structure of what is called as nucleotide. Now if you take this particular nucleotide is the one which are the building blocks of your DNA, right? All these nucleotides together, they combine to form the DNA. Now this particular nucleotide, there are three important structures. One is your sugar, which is nothing but your deoxyribose. Right, which is nothing but your deoxyribose. Next to the sugar, you have the nitrogen bases. Right, you have the nitrogen bases. The nitrogen bases, they include adenine, they include guanine, they include cytosine, right, and then they include thymine. So these are the nitrogen bases, and the third component in the nucleotide is your phosphate. Right, the third component in the nucleotide is the phosphate. Now let me tell you the mechanism of action. Now these drugs, that is alkylating agents, the word itself tells you. What these drugs do is, these drugs alkylate the nucleophilic groups on the DNA basis. Right, so what these drugs do, they alkylate nucleophilic groups, right, they alkylate the nucleophilic groups on the DNA bases. Now what are the DNA bases? The DNA bases, they include adenine, guanine, cytosine and as well as thymine. So these drugs, they alkylate the nucleophilic groups on the DNA bases. Now which particular DNA base is most susceptible is your guanine. So guanine is the one which is the most susceptible nitrogen base for alkylation. So these drugs alkylate the nucleophilic groups on the nitrogen bases, and thereby what will happen? So once the alkylation occurs, that will lead to the cross-linking of the bases. Right, that will lead to cross-linking of, right, that will lead to the cross-linking of the nitrogen bases. Now, so once there is a cross-linking of the nitrogen bases, that lead to abnormal base pairing and DNA strand breakage. So this leads to, right, this leads to abnormal base pairing and DNA strand breakage. Right, abnormal base pairing and DNA strand breakage. Now this is the mechanism of action. So thereby what are these drugs doing? They are breaking the DNA of that particular rapidly proliferating cells. So once they break the DNA of that rapidly proliferating cells, the cell die, and thereby there will be no rapid proliferation. Now you take the adverse effects of these drugs. Now the adverse effects includes the gastrointestinal distress, right, gastrointestinal distress, and there will be what is called as the bone marrow suppression by these agents, and there will be loss of hair which is called as the alopecia, and not only that, there is development of the secondary leukemias, right? There is development of secondary leukemias and sterility. These are the common adverse effects of all the alkylating agents, right? The other one is the sterility. Okay, so this is about your alkylating agents. So let me shortly revise. All these particular alkylating agents and their related drugs, they are CCNS drugs. That means they act on both resting and as well as the dividing cells. And if you take the mechanism of action, these drugs, they alkylate the nucleophilic groups on the DNA basis and may lead to the cross-linking of the bases, and thereby there is abnormal base pairing and DNA strand breakage. And the adverse effects, if you take, they include gastrointestinal distress, bone marrow suppression, alopecia, secondary leukemias and sterility. They are the common adverse effects of all the alkylating agents. Now let me discuss about the nitrogen mustards. Right, let me discuss about the nitrogen mustards. Now if you take this nitrogen mustards, one of the very important drug in this nitrogen mustards is your cyclophosphamide. Right, one of the very important drug in your nitrogen mustard is the cyclophosphamide. Now if you take this particular cyclophosphamide, remember this particular cyclophosphamide is a prodrug. Right, this particular cyclophosphamide is a prodrug. This particular cyclophosphamide, which is a prodrug, is activated by the hepatic biotransformation. So this will undergo hepatic biotransformation. Now by hepatic biotransformation, this cyclophosphamide is converted into aldophosphamide. Right, it is converted into aldophosphamide. Now this aldophosphamide is the active form of this cyclophosphamide. Now this is the active form. Remember, once the cyclophosphamide undergoes degradation, one of the degradation product of the cyclophosphamide is acrolein. So cyclophosphamide upon degradation, right, it is converted into a substance which is called as the acrolein, and this acrolein is the one which is responsible for hemorrhagic cystitis. Right, acrolein is the one which is responsible for the hemorrhagic cystitis. So for the acrolein, this is the characteristic adverse effect. Right, for the acrolein, this is the characteristic adverse effect. Next, let me tell you another very important point. This adverse effect, that is hemorrhagic cystitis, can be decreased by vigorous hydration, and it can also be decreased by the use of mercaptoethane sulfonic acid, which is nothing but MESNA. So hemorrhagic cystitis can be decreased by hydration, right, can be decreased by hydration, and can also be decreased, right, can also be decreased by the use of mercaptoethane sulfonic acid. Right, mercaptoethane sulfonic acid. Now if you take this mercaptoethane sulfonic acid, this is what is called as MESNA. Right, this is what is called as MESNA. So by vigorous hydration and by usage of MESNA, the hemorrhagic cystitis can be reduced. Now let me tell you the other important adverse effects associated with the cyclophosphamide. Remember, this cyclophosphamide may also result in what is called as the cardiac dysfunction. Right, cardiac dysfunction. It will also cause pulmonary toxicity, and apart from that, it will cause what is called as SIADH, that is syndrome of inappropriate antidiuretic hormone. In case of syndrome of inappropriate antidiuretic hormone, there is excessive production of the antidiuretic hormone, and this excessive antidiuretic hormone, it will cause the reabsorption of excess amount of water. That is what is called as SIADH. Next, now after having discussed about the cyclophosphamide, let me discuss about the other important drug which is called as ifosfamide. If you take this particular ifosfamide, remember this ifosfamide produces certain metabolites. The metabolites which are being produced by the ifosfamide, they include chloroacetaldehyde, right? They include what is called as chloroacetaldehyde, and if you take this chloroacetaldehyde, remember this is one of your nephrotoxic substance, right? This is one of your nephrotoxic substance, and we have another metabolite of ifosfamide which is nothing but your acrolein. Now you take this acrolein, what did we discuss? The acrolein is the one which is a degraded product of cyclophosphamide which will cause hemorrhagic cystitis. So remember, ifosfamide has same toxicity profile as the cyclophosphamide, right? Same toxicity profile as your cyclophosphamide, alright. But however, if you take ifosfamide, it is having the higher risk of the neurotoxicity, right? It is having the higher risk of neurotoxicity and as well as the hemorrhagic cystitis, right? As well as the hemorrhagic cystitis. Now you take this cyclophosphamide. Remember, cyclophosphamide is the drug of choice for the 𝐒𝐻𝐼𝐻 granulomatosis. Alright, it is a drug of choice for, okay, it's a drug of choice for 𝐒𝐻𝐼𝐻 granulomatosis. Remember, the adverse effect associated with the cyclophosphamide is it is a powerful vesicant. Now what do you mean by the word vesicant? Vesicant is a substance which will form vesicles over the skin. That is what is nothing but your vesicant. So let me shortly revise up to here what we have discussed. You take the nitrogen mustards, the important drug is your cyclophosphamide. The cyclophosphamide as such is a prodrug and is activated by hepatic biotransformation to active substance that is called aldophosphamide. And cyclophosphamide, upon degradation, it gives a product which is called acrolein, and that is responsible for the hemorrhagic cystitis, right? And this hemorrhagic cystitis, it is the characteristic adverse effect of this particular cyclophosphamide. And you take this adverse effect can be decreased by vigorous hydration and by the use of mercaptoethane sulfonic acid, which is nothing but MESNA. Next, the cyclophosphamide, if you see, the other adverse effects include cardiac dysfunction, pulmonary toxicity and syndrome of inappropriate antidiuretic hormone, and that is nothing but SIADH. You take ifosfamide. Ifosfamide, it produces what is called as chloroacetaldehyde and as well as acrolein. Chloroacetaldehyde is a nephrotoxic substance, alright. Now this ifosfamide, it has same toxicity profile as cyclophosphamide, however it has higher risk of neurotoxicity and hemorrhagic cystitis. And you take cyclophosphamide, remember it is a drug of choice for the 𝐒𝐻𝐼𝐻 granulomatosis and it is a powerful vesicant. So you take the other nitrogen mustards, that is your meclorithamine. So if you take this meclorithamine, remember meclorithamine, it is the drug which is best known for its use in case of Hodgkin's disease, right? It is the drug which is known for its best use in case of Hodgkin's disease. And remember, this meclorithamine, it is a powerful vesicant, alright, it is a powerful vesicant. Next, we have another important drug which is called as melphalan, right? Other important drug which is called as melphalan. So if you take the melphalan, it is the drug of choice for multiple myeloma, right? Drug of choice for multiple myeloma. So these are the nitrogen mustards which are used for various clinical conditions. Now we have what is called as nitrosoureas. right? We have what is called as nitrosoureas. Now you take the nitrosoureas, drugs like carmustine, 𝐒𝐿𝐫𝐞 and as well as 𝐒𝐻𝐵. These are highly lipid soluble and they can cross the blood-brain barrier. So drugs like carmustine, 𝐒𝐿𝐫𝐞 and as well as the other drug, that is 𝐒𝐻𝐵𝐾. Right, the other drugs like 𝐒𝐻𝐵𝐾. So these are the highly lipid soluble, right, and they can cross the blood-brain barrier. Right, they can cross the blood-brain barrier. Now let me tell you one important point here. Because these drugs can cross the blood-brain barrier, these are the drugs which are used for the treatment of the brain tumors like gliomas. Okay, these are the drugs which are used for the treatment of brain tumors, right? These are the drugs which are used for the treatment of the brain tumors, that is gliomas. Now the adverse effect associated with these drugs is these can cause delayed neutropenia, right? These are the drugs which will cause delayed neutropenia. So that is the adverse effect associated with the carmustine, 𝐒𝐿𝐫𝐞 and as well as 𝐒𝐻𝐵𝐾. Next, apart from this, like you take the other drug, that is dacarbazine. So if you take this dacarbazine primarily it affects the RNA and it also affects the protein synthesis, unlike the alkylating agents. So dacarbazine, it primarily affects the RNA, right? It primarily affects the RNA, and not only that, it also affects the protein synthesis, right? Primarily it affects the RNA and as well as the protein synthesis, unlike the alkylating agents. Now alkylating agents, they were predominantly affecting the DNA. Next, you take the other drug which is called as streptozocin. So if you take the streptozocin, they can destroy the beta cells of the pancreas. Because the streptozocin can destroy the beta cells of the pancreas, it is useful for the islet cell tumors, right? So it can destroy the beta cells of the pancreas, right? If you take the islet cells of Langerhans, the islet cells, it includes alpha cells, beta cells and as well as delta cells. Whereas streptozocin can destroy the beta cells of the pancreas, and that is why this streptozocin, it is useful for islet cell tumors. Right, it is useful for the islet cell tumors. Now, if you take the adverse effect of streptozocin, remember, it can cause minimum bone marrow toxicity. Right, it can cause minimum bone marrow toxicity. Now, apart from these drugs, you have some other alkylating agents like busulfan. So, other alkylating agents, that is busulfan. So if you take this busulfan, remember the important adverse effects associated with the busulfan, it includes adrenal insufficiency, right? It includes adrenal insufficiency. It can cause pulmonary fibrosis, right? It can cause pulmonary fibrosis. It can cause skin hyperpigmentation, right? It can cause skin hyperpigmentation. And this busulfan, it can also cause what is called as hyperuricemia, right? Hyperuricemia. So these are the adverse effects associated with the busulfan. Next, we have another important drug which is other alkylating agent which is called as procarbazine. Right, procarbazine, this is also one of the other alkylating agent. Remember, procarbazine is most leucemogenic and it causes disulfiram like reaction with alcohol. Okay, so this is one of the most leucemogenic. And apart from being leucemogenic, right? Apart from being 𝐒𝐜𝐫𝐢𝐚𝐴, this particular procarbazine, it also causes disulfiram-like reaction. It also causes disulfiram-like reaction with alcohol. The other point is, if you take this procarbazine, it also causes the CNS effects like hypnosis and vivid dreams. Right, it also causes the other adverse effects like hypnosis and as well as vivid dreams. Now, apart from this particular, the busulfan and as well as procarbazine, we have one of the other alkylating agent, which is nothing but chlorambucil. So, if you take this particular chlorambucil, remember chlorambucil, it spares myelocytes, right? It spares myelocytes, and it is used in case of chronic lymphocytic leukemia, CLL. Right, chlorambucil is the drug which is used in case of chronic lymphocytic leukemia. So let me shortly revise up to here. You take the drug meclorithamine. It is a powerful vesicant, right? It is a powerful vesicant. Not only that, it is the drug which is used in case of Hodgkin's lymphoma. And melphalan, it is a drug of choice in case of multiple myeloma. And you take nitrosoureas. Nitrosoureas like carmustine, lomustine and as well as semestine, they are highly lipid soluble and they can cross blood-brain barrier. Because they can cross blood-brain barrier, they are used in the treatment of brain tumors like glioma. And the other point is, they can cause delayed neutropenia. And you take the drug like dacarbazine. Dacarbazine primarily affects the RNA and it also affects the protein synthesis, unlike your alkylating agents. You take streptozocin. Streptozocin can destroy the beta cells of the pancreas, and that is the reason why it is used for islet cell tumors. And streptozocin, the adverse effects, they include minimum bone marrow toxicity. The other alkylating agents, if you say, that is busulfan. Busulfan can cause adrenal insufficiency, pulmonary fibrosis, skin hyperpigmentation and hyperuricemia. So if you take procarbazine, procarbazine is most 𝐒𝐜𝐫𝐢𝐚𝐴 and causes disulfiram-like reaction with alcohol. And this procarbazine, it can cause the CNS effects like hypnosis and vivid dreams. And you take the chlorambucil, it spares myelocytes and they are used for chronic lymphocytic leukemia. Now let me summarize the distinctive toxicities of alkylating agents, right? Distinctive toxicities of alkylating agents. Now if you see this distinctive toxicities of the alkylating agents, let me take up the drug and let me take up the associated toxicity, right? Associated toxicity. Now for example, you take cyclophosphamide. Cyclophosphamide, it is associated with the toxicity like alopecia, hemorrhagic cystitis and as well as syndrome of inappropriate antidiuretic hormone, that is SIADH. Then you take the other drug, that is ifosfamide, right? You take the other drug, that is ifosfamide. Ifosfamide, it will cause toxicity like hemorrhagic cystitis and syndrome of inappropriate antidiuretic hormone, that is SIADH. Next, you take the other drug, that is busulfan. So if you take busulfan, it will cause pulmonary fibrosis, hyperpigmentation and adrenal insufficiency, that is your busulfan. Next, you take the other drug, that is procarbazine, right? You take the other drug, that is procarbazine. Procarbazine, the toxicity is secondary leukemias, disulfiram-like reactions, behavioral changes and as well as the CNS depression, that is with your procarbazine. Next, you have the other drug, that is cisplatin. So if you take this particular cisplatin, the toxicity associated with the cisplatin is, it will cause very severe vomiting, that is emesis. It will cause nephrotoxicity, peripheral sensory neuropathy and as well as the ototoxicity. So these are the adverse effects associated with the cisplatin. So this completes the discussion of your alkylating agents, the nitrogen mustards and as well as the nitrosoureas.